All right, welcome everyone. It is noon on Tuesday and we are getting ready to start our next webinar with Dr. Douglas Wu. He is going to be speaking today about acne and other scars, acne and acne scars and general scars. So I will give you guys a few minutes to kind of get situated and join. I see a lot of you joining now. Welcome and thank you for coming. Hope you guys are enjoying hopefully getting some fresh air. It's beautiful outside. And to show you at the bottom of your screen, there are a couple buttons that you need to be aware of. The first one is the chat. If you want to send me a direct message or have any problems or concerns, you can post there. And there's also one called QA, which I think should be right here. And that one is for you to submit questions that you would like Dr. Wu to answer. First, he's going to give a short presentation, and then he will be available to answer as many of your questions as possible. So you're welcome to start popping in questions now, or you can start putting them in as he is doing his presentation. So just again, for those of you joining, I guess it's 12:01, I'll just give it one more minute to help us get started and to help Dr. Wu know who he is speaking with. I'm gonna launch a little poll right now, so you guys can tell us a little bit about what you're hoping to learn about today and what you are most concerned with. So a poll should have popped up on your screen. If you can, please complete it. And at the end, please click End Poll. I'll give you guys a little bit of time to get this done. All right, I see a lot of you answering. A few more seconds here to get your comments in. If you don't mind clicking submit, I think it says. Okay, 5 more seconds, press submit. All right, so let me end this. So only a few of you answered, but that's okay. So in here, we can see here, let's see, most of you are concerned to learn about acne and acne scars. So good, you're definitely at the right place. And then a couple of you just about other scars and one about acne. About half of you have seen a specialist for this before. Most of you have tried some over-the-counter creams, but it looks like very few treatments and a couple lasers. So. All right, so with that in mind, I hope everyone has joined and gotten situated. As a reminder, the Q&A is at the bottom. You are welcome to start submitting questions now if you have any for Dr. Wu. And otherwise, I am pleased to present to you Dr. Douglas Wu. He is one of our esteemed board-certified dermatologists. He has expertise on all types of cosmetic and medical dermatology, from injectables to lasers to body sculpting and more. But today he is going to be speaking about acne, acne scars, and other general types of scars. So hopefully this will help educate you all and be just informative and educational. So with that, I will hand it over to Dr. Wu.
Hey guys, thanks for tuning in. So most of the talk today is going to focus on acne and acne scars, which is actually turns out to be a very, very prevalent sort of problem that we face as both cosmetic and medical dermatologists. Acne is essentially ubiquitous. Almost everybody eventually gets some form of acne, whether it be mild, moderate, or severe. And anybody who has acne can subsequently develop acne scars. And so this actually presents quite a large proportion of my practice, even on a daily basis. So just as a quick outline for this presentation, we'll talk a little bit about like behind the science and why we get acne and acne scarring, kind of a look beneath the skin. And then we can focus on how we treat these problems in a very sort of rational way. And then finally, what to expect with some of the treatments that I'm going to describe today. So active acne and acne scarring. These are very, very common problems, as I've mentioned. The thing is, they're caused by a combination of things. Now, the skin, as we know, is made up of several basic layers, the so-called epidermis, the dermis, and the subcutaneous fat, three major layers. However, it's actually quite a complicated sort of organ that has a bunch of different other structures like blood vessels, etc. And in terms of acne, what we really need to understand is the part of the skin that we call the so-called pilosebaceous unit, which essentially refers to just the hair follicle and the oil gland, which is encased in the black box on the screen. If we kind of zoom into that, we can see that it consists of the oil gland, which is there, a little pore, and then the hair shaft itself, which may or may not even come out onto the surface of the skin. But it's this kind of unit from which all of acne essentially develops. And it's this unit that we target in all of our types of treatments. Let's kind of zoom in a little bit. This here is the oil gland, and it creates a substance that we call sebum. It's basically the oil of our skin. It lubricates the skin and gives us that oily, greasy sort of sensation. It gets produced by the gland, and then it kind of travels out of the pore onto the skin surface, where it kind of just sits on the skin and has actually very important functions on the skin. However, at the same time as it being on our skin, there's these little bacteria that also live on our skin. They're just normal bacteria. They don't cause disease or infection or anything like that. Everybody has them, and they're called Cutibacterium acnes. The bacteria on our skin essentially interact with this sebum. Okay, they metabolize it, and when they metabolize it, it's very irritating to our skin. And that irritation and inflammation eventually results in what we know as acne. It's those little red zits and pimples that we get. Okay, so it's basically a combination of that oil secretion and the normal bacteria that is already on our skin causing inflammation and irritation. Another form of acne involves this oil kind of clogging up our pores, as depicted here, and this kind of results in what we see as whiteheads and blackheads. Okay, so those are the major forms of acne. And to basically summarize, when we think about blemishes on the skin, they're inflamed sort of blemishes. There's the red pimples and zits that most people really, really hate. There are the so-called comedones. These are the little white and blackheads that also, are very displeasing. And then finally, if these kind of last on the skin for a long period of time and don't get treated, then the risk of developing subsequent scars is very high. And that can be a very displeasing sort of outcome as well. So that kind of sets the stage on what actually is acne. But more importantly, what really can we do about it? If we understand all of those kind of basic sort of principles about acne and acne scarring, then we can actually devise a lot of treatments that very logically and rationally address the problem in a very safe and effective way. So given what we know, our goals of therapy are to target those bacteria, okay, because they're one of the main causes of acne, is to modify in some way our oil gland secretion, to reduce the redness that is almost always part of acne problems. And then finally, if present, to treat the scars in a safe and effective way. Basically, lasers and energy devices can target both active acne and acne scars simultaneously. Okay, and it's one of the only treatment modalities that has that ability. And it is, of course, going to be the focus of this talk, but it's also important to know we're going to talk about something called photodynamic therapy and radiofrequency microneedling. But we really shouldn't forget that there are, of course, a large variety of standard medical treatments as well, including simple face washes and skincare products that can sometimes be actually quite effective, especially for maintenance after you've undergone, say, a laser treatment or otherwise. There are prescription creams that many of individuals with acne have already tried, tretinoin cream being one of the most popular and commonly prescribed. And then there are pills that can be, quite effective, but also carry with them significant risk and side effects. Photodynamic therapy is a very specialized treatment that we use to treat acne, and it involves essentially lasers to target both the bacteria and the oil glands, as well as reducing the redness and treating acne scars. So let's take a look again at our friends, the Cutibacterium acnes. What happens with these guys is they actually produce small molecules called porphyrins as part of their natural metabolism, okay? These porphyrins, they actually absorb light and laser energy specifically, and they store that energy. They become energized after being exposed to certain types of light and laser. And this energy is then transferred to their surroundings, and usually in the form of heat or some sort of chemical reaction. But whatever the case, it essentially transforms them into these highly energized bombs. And because they're produced by the acne, they're kind of, or by the bacteria, they're in that vicinity, and they then function to destroy the bacteria that are in the area. So this is a very elegant way to target those bacteria very specifically with lasers and cause very less minimal damage to the surrounding skin. Now, the good news is that we actually can make these porphyrins, and there's medications that we use that contain them, and that's how we really get the power of photodynamic therapy. Say, for example, this young lady suffers from a bit of acne, and we can actually apply the medication externally, which is a mixture of porphyrins essentially, and allow that medication to kind of sit on the skin and soak into all the acne follicles and pores, etc. And this increases the amount of target that the laser can then focus on, which makes the laser more powerful and more effective. Additionally, because it's an externally applied substance, it actually can target the oil gland as well, because it kind of seeps into those pores and mixes in with the oil gland. And that's a really powerful effect. There's not a lot of things that can do that. Some very, very strong medications can do it, but there are a lot of side effects associated with those medications. So this is a nice skin-targeted way that doesn't have any internal side effects and doesn't damage your organs or anything like that. So targets both bacteria and oil glands. Now, this is a chart that we don't really have to worry about too much, but it just shows how the the porphyrins, they absorb at certain different types of wavelengths. And blue light is the classic. You can see how it's the highest absorbed light, but red light also gets absorbed. I use a yellow laser as well as what's called an intense pulse light. And these also activate this medication, but also treat the skin to make it more beautiful, to reverse sun damage and photo damage, and also to treat any existing acne scarring with these lasers and lights. So it's kind of like an all-in-one sort of treatment, one of my favorite treatments for acne and acne scarring. Now here's a simple description of the process so you can kind of visualize in your head what actually happens during this process. Essentially what happens is that we get this is a picture of a chest, and the chest is a very common area for acne. We have this active acne as indicated by the red spots, and then maybe some acne scars with the black spots. The first thing that we do is degrease the skin. We just kind of wipe it clean with special solutions to make sure that it's super clean and the subsequent application of medication is able to penetrate. Sometimes we also even put a little bit of light laser on top of it just to help the medication get through the skin. That's the very first step. The second step is to actually apply the medication, okay? And it just goes topically over the entire area. It doesn't hurt, it doesn't sting. You don't feel a thing actually. And it just kind of sits there for between an hour to 3 hours as it kind of incubates on the skin and mixes in with the bacteria and the oil glands in order to make it the most effective. And then finally, there's the activation stage where we use a bunch of lasers and lights, like I mentioned, and they target that porphyrin and activate it. And the activation then helps to destroy the bacteria and shrink the oil gland, therefore helping to reduce active acne. So this is a clinical example here of an individual, one of my patients, who had moderate to severe acne on her chest and décolleté. It's very disfiguring and obviously quite a cause for concern. You can see here that she's got these active spots kind of in the black circles. There's some older spots here with the green, and then just a little bit of scarring just kind of everywhere that is just causing a very unpleasing appearance in the skin. With photodynamic therapy, even between 1 to 3 treatments later, we can get a significant improvement. It's not perfect, of course, and further treatments can actually improve the situation even more, but the active acne is drastically reduced and a lot of the scarring has improved as well. Similarly, on the back, this is a very difficult area to treat normally with creams and stuff. There's no way really that you can conveniently apply a cream to your entire back. And then pills can sometimes work, but the back can be resistant and there's some side effects with the pills. With laser, we can just basically treat the entire area in one go and help to improve the situation significantly. The face, of course, is the most common area that we treat, and it tends to respond actually the best to treatment. Here's a young lady who had, severe inflamed acne. She had also significant kind of scarring here and there, and then a little bit of these little comedonal acne spotted about. But you can see how after a couple treatments of PDT, it's almost completely resolved, and her skin looks great. Similarly, this young lady here, she had the combination of inflamed acne, but she also had a lot of little kind of whiteheads kind of scattered about the forehead, very common location for whiteheads, and then this kind of patchy redness all over the place, which is really standing out because she's quite fair-skinned. And this is really the advantage of using a laser, is because we can target all of these things all at once. If we just use the cream or a pill, then we might be able to reduce some of these larger acne spots, for example, but the other cosmetic concerns would not be adequately addressed. And she had a treatment or two, and her skin is vibrant and beautiful, and even the quality of the skin seems to be much, much improved. Of course, again, it's not perfect, but realistic is the goal. Men tend to get severe acne in the chin and jawline area that can lead to massive amounts of scarring. This individual here presented to me, he was one of my patients with inflamed acne to his chin and around his mouth area, very, very disturbed by this kind of presentation. After some PDT, it's mostly gone. This young man as well, a very severe acne. You can see even some of his acne is causing these elevated, raised, inflamed areas. And we know that if we leave that for any longer, it's going to form very bad scarring. And that's going to be even more difficult to treat. And so capturing it early is actually very important. But with some photodynamic therapy, the improvements can be really, really impressive. This individual here, one of the worst cases that we see, already with significant scarring all over the place from previous acne, but still ongoing, highly inflamed, highly damaging sort of acne lesions. Photodynamic therapy was able to tidy up most of his active acne, which is good, but his resulting scarring required considerably more treatment after photodynamic therapy to further improve. And then this young man, similarly, having the scar, the acne that was tidied up by the photodynamic therapy. Now, so active acne can be nicely treated with some of our lasers and lights, but what about the scarring? Because that also is a really major problem and kind of goes hand in hand with the active acne. The residual scars can actually be treated after the active acne is controlled, or at the very least, in combination with an effective controlling method. The reason is because, as you can imagine, if you have active acne ongoing, okay, you don't really want to necessarily focus on the scarring at that point, because if your acne is uncontrolled, then that can continue to scar your skin and you're kind of fighting an uphill battle. So acne scars, very, very, concerning. And here we have our little diagram of acne again. There's these inflamed sort of spots here. And even after the inflammation goes away, the damage that they cause, it causes a lot of loss of skin structure in terms of collagen and the proteins in the skin. And this causes the skin to kind of sink inwards in this divoted sort of pattern, which is classic acne scarring, these ice pick little scars or rolling sort of indentations that are really disfiguring, and nobody really likes those. Now, the way we treat acne scars, and actually all types of scars that are sunken in, is to try and stimulate new collagen growth. Okay, and there's a lot of ways to do it. And for sake of time, I'm not going to go into all the different ways, but I've selected one particular method which I find to be actually really effective for acne scarring. But basically, all of these devices, they introduce what we call controlled injuries into the skin, which results in a very controlled healing process that stimulates new collagen growth, but doesn't result in any further scarring, and usually can be confined to areas that require treatment, thus minimizing downtime and discomfort and all this types of stuff. The type of technology that I'll be kind of talking about over the next couple slides is what we call radiofrequency microneedling. Microneedling is a fairly common sort of technique that we use these days to rejuvenate the skin. However, basic microneedling is just taking a tiny little needle and poking holes into the skin. It's okay, but it's not really powerful enough to address most types of acne scarring. And so we add an energy component to the microneedling called radiofrequency. And basically what happens is that the needle is entered into the skin at a certain depth, and at the tip of every needle it releases a burst of sort of energy that causes the skin to heat up. And that heat essentially stimulates new collagen growth, but in these very focal areas. And what's beautiful thing about the microneedling, because it's a physical needle, it can go to any depth that we want. There's multiple different depths that can be targeted within the skin. Unlike laser, which sometimes, you can only, it's just one laser beam. So it's gonna hit all these levels. But with microneedling, we can really focus on different types of levels. And it's only at the tip of every needle that we get this energy burst that then delivers very focused energy and stimulation of collagen. And so the targeting of different levels of the skin and the stimulation of new collagen is kind of the major principle behind treating the acne scar and many other types of scars as well. It helps to smooth out the skin and restore the skin quality. This was a young lady who presented with both acne scarring and active acne at the same time. And she wanted a treatment to kind of address both. And so in her case, I selected radiofrequency microneedling because her skin tone was a little bit darker. And with the photodynamic therapy and the lasers associated with that, sometimes darker skin can be a little bit too sensitive for that type of treatment. But with the radiofrequency microneedling, we do a treatment. She actually had 2 treatments of this procedure, and her skin is almost flawless after this type of treatment. She still has some residual here and there, but it's a vast improvement over what she previously experienced. Similarly, in this case here, this is already established scarring, okay? You can see in the sort of lateral cheek area here, there's these little divots and they're kind of reddish and just, very, very common. I see this all the time in ethnic skin tones. It's very, very common type of acne scarring. But with some radiofrequency microneedling, you can see how, although again, it's not perfect, scarring will never be fully erased, but you can see how the skin quality is much improved. And this young man was, he communicated to me after a series of treatments. He said he was able to kind of lift his head up in public and really go about his day and his life without really worrying about his scars as much anymore. And that I felt was a very nice outcome. This was a severe case of acne and acne scarring. This young man, unfortunately, he actually had a little bit of a mood instability. And so he went on a medication for his mood problems, and that actually caused an acne flare. Tons of, horrible acne everywhere that left him with scarring. But after a couple microneedling treatments, there's much improvement. And then similarly, again, in skin of color, it's important to realize that sometimes we have to choose something like radiofrequency microneedling in order to decrease the risk of traditional laser. And then sometimes the scarring is really pitted. You can see with this individual, it's really indented. And in this kind of situation, sometimes you really need to combine a variety of different treatments. In his case, I did microneedling, but also injected some filler and did a little bit of minor acne surgery on these scars. But you can see that the final result is almost completely gone, and the skin is much smoother. So what can you expect with these types of treatments in terms of downtime and how many treatments it'll take and what kind of results will you get? I get these are probably the primary questions that I get every time that I do this treatment. So downtime, I think it's best to illustrate with one of my patients here. You can see that on day, basically the next day after a photodynamic therapy treatment, this is with PDT, but it's very similar with radiofrequency microneedling. You can see that she's quite red on day 1, 2, and 3 with increasing amount of sort of this peeling and basically a very severe type of sunburn-like reaction. And this is a spectrum, of course, sometimes it's less, but not often is it more than this. So this is about as bad as it gets. But by about day 4 to 5, you can see that in this picture here, it's mostly resolved. There's kind of a shadow of redness that remains. And then day 6, there's a little bit of darkening, but this was day between 7 to 10. And you could see how her skin, not only is it completely normal, it's totally recovered, but it already looks a little bit better than it did previously. So that's kind of the downtime that I usually describe to patients. It's the first 3 to 5 days can sometimes be a little bit inconvenient, to be honest. But then after that, the skin tends to heal quite rapidly, and you don't usually have a lot of problems after that. There are some exceptions, of course. The more severe your acne is to begin with, sometimes the more severe is your downtime. So in summary, acne and acne scars are really very stubborn conditions, unfortunately, okay? And they can be quite slow to respond to treatment. This is an expectation that we have to really understand when we embark on a journey of treating acne and acne scars. And it's something that I try to communicate very clearly every time I see a patient who has these concerns, because what I can definitely promise and guarantee is that if you stick with the plan and you do the right treatment at the right time in the right way, then definitely the improvements are going to be amazing and it's going to look great, but it can take some time and patience. Sometimes combining a variety of lasers and energy devices is actually the best way to go, including injectable treatments, etc. At my practice, I use somewhere in the range of 40 to 50 different lasers and energy devices, as well as all of the injectable treatments that are currently available in the US. And so every patient who comes to my practice gets a very specific and tailored treatment plan that is focused on their individual concerns. After treatment and around treatment, maintenance with good skincare is very important. Okay? It helps to prevent flares, it helps to make the results of the treatment better, and helps to prevent recurrences as well. And then finally, the really most important thing is that nobody's skin is the same. And so everybody's treatment plan has to be a little bit tailored, has to be a little bit unique, but as long as we do the right treatment at the right time in the right way, then the results can be very, very satisfying. So that's really about all I have to say. Thanks for watching. I think there's time for questions and stuff, so I'll flip back to Risa and she can kind of moderate that.
Great. Thank you so much, Dr. Wu. That was very helpful and educational, and I think everyone hopefully enjoyed it. So for those of you that now would like to ask Dr. Wu some questions, on the bottom of your screen is a little Q&A. A number of you have already put some questions in there, but if you have any new ones, please add them, and we are going to start right now with the Q&A. All right, let's do this. So, hi, Dr. Wu. Do you do TCA cross? And can you explain a little bit what it is? Thanks, Dennis.
TCA cross is a specialized form of chemical peel using trichloroacetic acid. It's not actually a procedure that I perform commonly, but the power of TCA cross is to focus on individual acne lesions. Unlike a general chemical peel that takes care of the whole skin, but has sort of limited effectiveness, TCA cross takes a very concentrated form of the trichloroacetic acid and just spot applies it to little spots of acne scarring. And therefore, it tends to be a little bit more effective than just regular chemical peel. However, you know, in terms of its effectiveness compared to laser and energy modalities, I would say it has a mild to moderate sort of effect on a scale of laser and energy devices.
Great. Okay. This one says, hi, Dr. Wu. Thanks for the excellent lecture. What are your thoughts on subcision versus microneedling plus PRP versus the latest generation of RF microneedling?
So the short answer is that all of those treatments, with the possible exception of PRP, have proven evidence to prove that they actually are effective. And what I do in my practice is I combine them all. For the right types of scars, subcision can be extremely effective, but again, it has to be the right type of scar. So clinical examination is very, very important. And for other types of scars, microneedling can be, with radiofrequency, very, very effective. The addition of PRP with microneedling has thus far anyways not really been fully established as extremely effective, and the evidence is not quite there yet, so I don't often imply that or sort of apply that additional treatment. But you know, it's an evolving field, and it's certainly not an illegitimate treatment. It can definitely be beneficial in some cases.
Great. Okay, let's see, these are coming in fast. All right. This one's from Mindy. I am 63 years old, post-menopausal female. Since menopause, I've developed acne on my chin only. What do you suggest to be the most effective?
Oh, I'm sorry to hear that, Mindy. That's very frustrating. Just when you think you're past the acne for good, right? Well, without seeing your skin in person, it's hard to necessarily give very specific kind of recommendation. But what I can say is that normally when we see acne in postmenopausal individuals, or when we see acne that is focused mainly on the chin or the jawline, one of the major causative reasons is hormonal fluctuations, okay? And so Although photodynamic therapy and microneedling and stuff like that can be useful adjunctive measures to control the acne, sometimes if a hormonal etiology or a hormonal cause is identified, the most effective treatment is actually hormonal type treatments. Okay? And these tend to involve pills that are taken, special pills that are taken that can modify the hormone response. So that might be a treatment option for you. Hard to say without seeing your skin, but there are, as I mentioned in only one of my slides in this lecture, but there are literally hundreds of acne treatments. And as you go to a board certified dermatologist with additional specialty in laser, then you'll have all of those options available to you. So he or she can decide to make the best plan for you.
Okay, great. All right, this one's from Carol. I will be coming in for treatment from out of state. Would I be able to get a consultation via video in advance of my travel to California for treatment?
Yeah, absolutely. Actually, we do virtual consults and have been doing more virtual consults, obviously, these days. But certainly that option is available. And if you go to our website, I think it's on somewhere on this page. It is not. Well, it's clderm.com. If you go to our website, then you'll be able to find out the information about how to do that.
Yes, and I concur. On our contact page on our website, you can actually schedule right on the contact page, or you can, of course, call or email us as well, and we could definitely set you up for a video consultation. Okay, let's see. What is the difference between whiteheads and blackheads, and how can I prevent them? This is from Bruce.
Yeah, so whiteheads and blackheads are both what we call comedones, but they look different. Obviously, one is white and one's black. And the major difference between a whitehead and a blackhead is a blackhead is what we call an open comedone. So what that means is that the pore is not fully blocked, but the contents of the pore, so that all that sebum, etc., it's exposed to the air. And the air, the oxygen specifically in the air, oxidizes those contents and turns them black. That's why they become blackheads. They're clogged pores that have been oxidized by the air. In the case of a whitehead, it's a closed comedone, so it's actually not in contact with the air. It's fully closed off, and so the skin that's blocking your pores remains unoxidized and therefore still that whitish or yellowish color. That's basically the difference. The treatment options are many and include regular face washes. Salicylic acid-based face washes have been shown to improve the situation. It's a very safe treatment. It may not be super effective, but very safe. This one step up from that would be prescription creams like retinoids or even over-the-counter creams that contain retinol. Okay, it can be very effective for treating these types of problems. And then there are pills that do it, but pills aren't really that great for comedonal acne. Antibiotic pills and Accutane, usually not a good option for that. And then finally, lasers and microneedling actually can be very effective at releasing these pores and eliminating the problem. There's the one young lady I showed in my slide presentation, not sure if you recall, but she had a lot of this kind of whiteheads and blackheads on her forehead. That photodynamic therapy managed to eliminate all of them.
All right, so Dr. Wu, which PDT photosensitizer do you use for inflammatory acne?
So I use 5-aminolevulinic acid. This is the standard FDA approved, one of anyways FDA approved medications for this purpose, although it's approved for precancerous lesions and not necessarily for acne. But 5-ALA is the one that I use and the one that tends to be most commonly used.
Okay, great. How does RF microneedling alone treat active inflammatory acne lesions? Doesn't C. acnes still remain on the skin?
Yeah, this is a very good question. Conceptually, you're right. Radiofrequency microneedling is not a complete treatment for active acne. However, practically speaking, it does actually have some effect. And the reason it has this effect is because the heat that it delivers to the skin and the subsequent changes that are caused by that heat, number one, can affect the oil gland, okay, by shrinking it or even just destroying it. And number two, it can reset the normal skin bacteria on the surface. And it's that resetting of baseline that can cause an altered response that then improves the subsequent acne. So it's actually a very interesting thing. You're right that it's a little bit counterintuitive. It doesn't really address all of the sort of issues that I outlined, but practically speaking, there's evidence to show that it works. And in my practice, I do use it sometimes for active acne, and it tends to have a pretty good effect.
Okay, thank you so much. Let's see. If I have a lot of scars of different depths and sizes, can one laser fix them all, or would it take different lasers with different frequencies for each?
So the answer to that question is usually a combination of different types of treatment methods will be best for that type of picture. And that not necessarily limited to just different lasers. It could be different types of energy devices, lasers, microneedling. It could be different types of minor surgical procedures like subcision. It could even involve ultrasound devices or injectable devices. There are a lot of different options for acne scars. And finding the right one for you and the right combination is kind of the job of your provider.
Okay, great. All right. We have time for a couple more questions. So if anyone else has some, let's see. My scars are raised with a weird texture. Is that fixable?
Yes, so raised scars are also commonly seen in acne. Not as common as the divoted ones, but I didn't spend a whole lot of time on those. But when the scar is raised, the treatment sort of algorithm kind of changes a little bit. We have to reduce that hard, thickened scar tissue. And the way to do that is to also add a little bit of an injection to break up that scar tissue. Otherwise, the microneedling and the PDT, that can still work for the rest of the issues, but to break up that scar tissue, a little bit of an injection tends to need to be added to those situations.
Interesting. Okay, and a follow-up, how about the redness in my scars? Can you
Yeah, and the
treat that?
redness is usually not treated by traditional PDT, but in the way that we do it, by combining lasers and lights, the IPL and the yellow laser are actually the gold standards for treating redness of all varieties. So they're actually very effective for treating acne redness. And you could see in many of my patients, the redness was one of the very first things and one of the most obvious things to improve.
Okay, so Rosemarie says, you mentioned hormonal treatments. Do you check hormone imbalances and adjust with HRT accordingly? I have areas, my back, arms, and face that have acne and spots, but seem to refill just when I think it's gone with a more rubbery substance. Help.
Yeah. This is a very good question, and there's not a simple answer to it. So when I say hormonal sort of imbalances, it's a very broad sort of catch-all term, and it represents a spectrum. The majority of individuals who have hormonal acne, we know based on our studies that the hormones are playing a role, but their imbalances are not such that they're pathological in terms of you won't be able to detect them on a blood test, and they aren't causing disease elsewhere in the body. Okay, so for those individuals, which represent the majority, I don't think blood testing is necessary, and most people do not do it before starting simple hormonal therapies for acne. Okay. However, there are those individuals when on medical examination and further history taking, there are identified problems that are suspicious for actual hormone imbalances that are causing medical pathology. Those individuals should definitely be worked up for further, blood testing and stuff like that, and then referred. I tend to refer them actually to specialists to deal with those issues.
Okay, beautiful. Um, is there a certain type of filler you prefer for atrophic acne scars, hyaluronic acid or Sculptra?
So I guess the short answer is I've used all in the right situation for the right type of scar. Each individual filler has special characteristics that are unique to them. And so I select the filler based on what I feel that the patient needs. Um, so I guess it's tough to say. I do use them all the HAs I've used, the Sculptra I've used, even Bellafill I use not infrequently. Bellafill is a permanent acne scar filler.
Okay. How long do the fillers last?
And that also depends on the type of filler. So Bellafill is considered to be semi-permanent to permanent. We now have over 10 years of data with this product, and it tends to be quite long-lasting. Sculptra is rated by the FDA to last about 2.5 years, depending again on how much you use and where you use it and for what indication. But that is probably the next longest-lasting filler. And then there are some longer-lasting HA fillers that may or may not be appropriate for most cases of acne scarring because they're too thick and too lumpy. But I would say HA fillers tend to last a good 6 months to a year, again, depending on which one is used and how where it's placed.
Okay, here's two questions I'm going to try and combine. So one person said, is there a difference in treating a scar that's new versus old? And then someone else says, is age a consideration? I'm 20, I'm 20 something. Can my acne scar be completely removed now?
Yeah, so in general, and this applies to almost all types of scarring, the earlier you catch it and treat it, the better will be your outcome. Okay, so the improvements will be more significant if you catch scars early. That being said, a scar of any age can be treated, okay, and it can be improved. They just might be a little bit more resistant. It may take a little bit more treatments, and it might take a little bit longer. But essentially, the earlier the better. And of course, preventing acne and scarring is the gold standard and the holy grail.
Okay. If I have active inflammatory acne with scars, would you recommend that I visit a regular dermatologist to get the acne treated first and then visit you for scar treatment?
It's a personal choice. Many patients who come to me for their active acne have, in fact, explored many other medical avenues like creams and pills, etc., and then have come to me for further advice and potentially laser. On the other hand, many patients come to me simply for their acne and want a unified plan, knowing that I have all of the options available to me, and I therefore can recommend the best for them, not just what I have. So it's a personal choice, and I want just the best for your skin. Whatever you feel comfortable with is the way you should go.
Okay. All right, we'll do 4 more minutes, guys, until 12:45. So what is the best treatment option for C-section scars, and how soon should we start after delivery?
C-section scars are considered a surgical scar or a traumatic scar. The best way to treat those is to combine a special type of laser or a radiofrequency microneedling device with a red addressing laser and with an injection of a special medication. This triple combination approach is essentially the best way to treat those types of scars.
And if I'm going to have more than one child, should I wait until I'm done having children to treat the scars, since they will
Yeah,
probably be the same
absolutely.
children?
Absolutely.
Okay, let's see. This one might be hard, but we'll try. Is there an approximate cost for treating acne on chest and back?
Yeah, quite difficult to answer that one because it really depends on what types of treatment is required and how much of the skin surface is involved. Um, so, a rough range would be in the, and this is a very broad range, so I apologize, but probably in the hundreds to thousands per treatment. Okay, so anywhere between low hundreds to, 1,000 to 2,000.
I'll also just throw in there that this is one of the reasons, why a consultation could be great. A virtual consultation, if you send photos, Dr. Wu could help determine exactly which treatments he recommends and give you an actual quote. It could be a virtual consultation or in person. So, and we did already have our first round of our soft reopening, which I'll speak about more at the end, but it does include medical conditions like some scars. Okay, let's see. Thank you, Dr. Wu. Very great presentation. I had Bellafill injected, but I'm not satisfied. It was treated by another doctor, not you. Can another HA filler be added on top?
The short answer is yes. You can layer and combine fillers as long as if I examine your skin and determine that it's safe to do so, then it can be done. And I have done it before, and I do it.
Okay. Do you have any products or treatments for pregnancy active acne and acne scars?
That's the toughest. That's really tough. The short answer is probably not really. There are some creams that are rated pregnancy category B to C, okay, by the FDA, meaning that they haven't proven that they are harmful to the child or to the fetus. But often, creams and definitely pills are not the way to go for pregnancy. And even laser, I mean, if we put it into context, these are essentially elective treatments, and they do have some downtime and they're stressful and stuff like that. So, I tend to recommend for patients who are pregnant and come to see me and want treatment, I tend to counsel them to wait until after their pregnancy is done and the baby is safe, and then we can deal with their acne. There's no rush.
Okay, great. All right, and final question. When will Cosmetic Laser Dermatology open again? Can't wait to see Dr. Wu for the first consultation.
Aw.
Great segue. Basically, we have done our soft reopening already. It started yesterday. So if you go on our website, clderm.com, there is a whole little letter in our COVID banner about what we can and cannot see. We are currently open for non-cosmetic visits. So a number of things do fall into that category, some of which do include acne and certain scars. We hope to be able to open for everyone else as soon as it's safe and we are, legally allowed. We're waiting for the California governor to make an announcement later today, but we are optimistically hoping that it may be as soon as this Friday, May 1st. So please make sure you're following us on social media because we will announce it there first, and of course send out an email as well. And otherwise, thank you so much for all of you that tuned in. I hope we were able to answer the majority of your questions. Dr. Wu is available for virtual consults, and you can pre-schedule now for an in-person consult. Otherwise, I want to thank Dr. Wu for this great presentation and for all of you that joined us. And I hope it was educational, informative, and made you a little happier for your day.
Thank you. Bye.
Thank you so much. Bye, everyone.